I'm really pleased that this project has been shortlisted for the Health Service Journal Award. This, without a doubt, is one of the things I'm most proud of in my career, leading cancer transformation. I think the opportunity to really hear from patients what we've not got right about their care and their experience, and to then match that to some existing science and research and create something really transformational and innovative that absolutely addresses that issue and we can see makes a difference, is something you don't get the opportunity to do very often. I think there are 3 really strong reasons why we should win this award. The first being that this is about absolutely responding to what we've heard from our patients, but bringing that together with cutting-edge science and research, and the opportunity to bring those 2 things together to create something is really quite unique. Secondly, we have gone from a germ of an idea and a research trial to something which is hugely scalable. So right across Wessex, we have 21 different sites operating exactly the same consistent standard of intervention and accessible for all of our population. And finally, this is about something that really makes a difference. We know from the patients that have experienced this what a transformative effect this intervention has on their lives from an experiential and emotional perspective, but also we're seeing downstaging of tumours within 14 weeks, which is something we had never seen before from exercise and support alone. So all of these 3 reasons together, I think, put this programme absolutely at the heart of what we're trying to achieve in terms of cancer improvement. We had some really clear ambitions right at the start. The first being about addressing patients' loss of identity and ability to cope right from the point of diagnosis of cancer and how we could support that and transform their experience of treatment. The second being about transforming the physical and emotional impact of cancer treatment so that both patients and their families felt they were in control, and also that they had a different physical outcome as a consequence of the support and intervention that we were putting in place for them. And thirdly, we set the ambition pretty high in terms of our level of innovation and our level of scalability. We wanted to come up with something truly transformational, something that had not been tried before and that we could scale and make available for our whole population right from the start.
This journey started 12 years ago in University Hospital Aintree in Liverpool, and this formed the basis for the WesFit trial. I met a patient who was undergoing major cancer surgery. He took part in our very first feasibility trial to do some exercise training in hospital, and he came to me after he'd had his surgery, came to visit me, and he said, "It was a double whammy of goodness, you saved my life," because he wasn't fit before and he was when he went to surgery. I'm determined to continue to build on the evidence base to be able to rapidly translate the evidence from the literature into business as usual clinical practice.
The evidence base that led to the development of WesFit was sought through patient experience as well as scientific research. We know that when someone is diagnosed with cancer, there is a crucial window in which they need to receive adequate levels of support and advice so they don't end up feeling as though they have become their cancer. Cancer treatment affects a patient's physical fitness. WesFit was the first to show that cancer treatments affect the mitochondria in the body, effectively the batteries we need to run on. It wasn't just that a patient felt fatigued. The treatment that was doing good for their cancer was also doing harm. Preparing for cancer surgery could be compared to the preparation required when running a marathon. A runner would not take on a marathon without preparing their body for the risks of dehydration, fatigue, and intense physical endurance such an event would place on their body. Cancer surgery should be treated as the same level of endurance and ask of the human body, so the training should also be comparable. Clinically robust evidence has proven that the less physically fit a person is before cancer surgery, the higher their risk of poorer outcomes and morbidity. If you had chemo and surgery, then you had 50% more chance of mortality at 12 months. WesFit was developed to reverse this impact of treatment and surgery, offering a minimum 2 weeks and a maximum 15-week tailored programme. The personalised training that WesFit develops and plans for a patient not only leads to better outcomes, reduced length of stay post-surgery, and lower risk of complications, but the trial has also shown that by improving your physical and emotional well-being, a tumour can be downgraded in just 14 weeks. Focus groups were set up to determine what it was the patient wanted in terms of support, how they wanted that support, and where it would be most vital for them to receive this. The entire WesFit project has been co-designed by our patients, and their involvement has made such a difference to the results we are now seeing. WesFit has partnered with charities and community exercise facilities to ensure the support offered to patients is local and accessible. Wessex Fit for Cancer surgery intervention is unique in the fact that it provides a prescribed support service for each patient. They are screened and assessed, and then their package is tailored to meet their individual needs. We have 10 community gyms and 6 cancer support centres running WesFit services. 17 out of 19 cancer alliances across England have requested to be involved in the WesFit programme. Internationally, we have also had significant interest, with similar programmes now being implemented in Jamaica using our evidence and outcomes. Moreover, we have presented our findings in clinical research to countries across the globe, including Australia, Singapore, Sri Lanka, and New York, to name just a few. We are delighted with the progress that has been made. 12 years on, we have now carried out 7 clinical trials. What we hope for the future is for the WesFit service to include the addition of nutritional supplementation advice for patients, alongside the physical exercise and psychological support for the patient's mental health and well-being. The values realised by the service have been ongoing since the start. By reducing the length of stay in hospital, there is a direct impact both on the long-term health of the patient and on the cost for that patient's care. We are also seeing patients who, having been through the WesFit trial, want to remain fit and support their own recovery. If we can realise a behaviour change in a patient, they may not get another disease, they may not have complications, and they may live a longer and healthier life. We know we can provide a patient with all the benefits and none of the negative side effects of cancer treatment prior to cancer surgery, simply by creating an intervention that improves their physical fitness and mental well-being at the right time. Since it began, the WesFit trials have provided pre-surgery support to patients with various tumour sites, including lung cancer, esophageal cancer, stomach and gullet cancer. We have recorded a 97% adherence to the training carried out at the hospital or fitness centres, whereby attendance is required up to 3 times a week. The impact of COVID-19 has been staggering for cancer care and cancer services. For WesFit, the service was paused in early March, and 9 patients had to be told that the trial was temporarily unavailable. Knowing how vital this was to their journey, it was crucial to us that we found an alternative. Within a matter of weeks, we set up WesFit as a virtual service with Can Rehab fitness instructors and in partnership with Macmillan to continue delivering exercise programs and emotional support to patients who are now shielding in their own homes. This virtual version of WesFit is known as SafeFit, and it is delivered via video links shared with patients by fully qualified instructors. Feedback from patients has shown us already that this was the most positive thing we could have achieved for them. Since launching the virtual service, over 100 patients have already self-referred. But the real benefit realised by WesFit can best be described by a patient himself.
In the spring of 2018, I was in a pretty bad way. Following treatment for prostate cancer, I was diagnosed with kidney failure. What followed was 18 months of illness, hospitalisation and minor surgical procedures. I had a suprapubic catheter, 2 nephrostomies, stents and constant visits from the community nurse. Pain, lost 4 stone, struggled even to get up in the morning, let alone get dressed. All the time I was feeling, what's the point of going on? Major surgery was proposed, and on a pre-op appointment at Southampton Hospital with my consultant, I was asked whether I wanted to join a research program called WesFit. I said yes, and then I became participant number 1 in the program. Fortunate for me, I was offered both counselling and physical training. Not overstating the facts, my life radically changed in the following weeks. Sceptical about counselling, being a bloke and all that, and brought up not to express one's emotions, I was pleasantly surprised. We discussed some difficult topics, some of them going back to childhood evening, but we addressed the main one of the feeling of guilt to my family. My counsellor pointed out to me that actually it's not my fault and I should not be beating myself around the head about it. Now, the exercise bike. Interesting. Never been on one before. Perfect stranger to the gym, and with my bags, tubes, just feeling very uncomfortable on the bike itself. The WesFit team accommodated me, supported me, and at each meeting we went further on the bike, faster on the bike. My strength grew and my positive approach to everything improved. So much so that I actually drove myself to some of these appointments, and I hadn't been driving for nearly 18 months. I even went shopping at the local Waitrose afterwards. Now, the operation. I was forewarned if I didn't get up and become mobile soon after the operation, I would be in there for a few weeks. If I got up, moved around soon after the op, I could be home within a week. The op took 2 consultants in 9 hours. Day 1, I walked myself from the high dependency unit with a little assistant with my bags, etc., to the general ward. Day 2, I was told I should go for a walk, walked along the corridor, seemed miles, but I did it. Day 3, with my wife, went down a couple of floors, had coffee. Day 4, I was home. I can honestly say that I am now back to where I was before all this happened, admittedly with a few modifications. WesFit program helped considerably, increasing my physical fitness and encouraging positive attitude. Nearly 2 years on, there is still a residual effect. I'm eating more healthily than I did before. I try and exercise much more. I'm just generally aware of my health, even down to purchasing a Fitbit to monitor my lifestyle.
We're a support system. We're professionals, so we also are able to support the patients with their medical questions as well as all of their concerns. They're in a dark place. They're sometimes on their own because they don't talk to their relatives. We're sympathetic, we're knowledgeable, and we're empathetic. These patients have said to us, all of us, in all the patient focus groups, that what we're doing is phenomenal. Why is this not standard care? It should be standard care. Why can't everybody have this phenomenal service that's supportive and delivered close to our homes? I'm a clinical academic, but I'm much more clinical than I am academic. That's what gets me out of bed in the morning. Just one patient saying, "You've made a difference to me."